Hey there, future dental pros. Welcome back to another essential lesson. Today, I'm diving into something every dental student needs to master: the emergency management of pulpitis and dental injuries. Handling pulpitis and dental injuries in emergencies can be daunting, but with the right knowledge and skills, you can manage these situations effectively. Got your gloves on? Let's get started. First off, let's talk about pulpitis. Pulpitis is an inflammation of the dental pulp, which can cause severe pain and discomfort for the patient. When a patient comes in with a toothache, the pain can be intense, often radiating to the jaw or ear. This can be quite distressing for the patient. The first step, a thorough examination. This includes taking a detailed history and performing a clinical examination to identify the source of the pain. Use a periapical X-ray to check for any visible issues such as decay, fractures, or other abnormalities that could be causing the pulpitis. If the pulpitis is reversible, focus on removing the decay and placing a temporary restoration. This can help alleviate the pain and prevent further damage. But if it's irreversible pulpitis, a pulpectomy might be necessary. This involves removing the inflamed pulp tissue to relieve pain and prevent infection. Remember to explain the procedure to your patient and get informed consent. Clear communication is key to ensuring the patient understands the treatment and feels comfortable. Next up, dental trauma. Dental injuries can happen suddenly and require prompt attention. Let's start with a common scenario: a knocked-out tooth. Time is critical here. The quicker you act, the better the chances of saving the tooth. If the tooth is still in good condition, rinse it gently with saline, but don't scrub it. Scrubbing can damage the delicate cells on the root surface. Place it back into the socket if possible, and ask the patient to bite down on a clean cloth. This helps to stabilize the tooth until you can provide further treatment. If reimplantation isn't an option, store the tooth in milk or a saline solution, and get to a dentist ASAP. These solutions help preserve the tooth until it can be reimplanted. Now, for fractured teeth. These can vary in severity and require different approaches. Assess the extent of the fracture using an X-ray. This will help you determine the best course of action. For minor fractures, smoothing the rough edges and placing a composite filling can work wonders. This can restore the tooth's function and appearance. But if the fracture extends into the pulp, a root canal might be required. This procedure removes the damaged pulp and seals the tooth to prevent infection. Always manage the pain with appropriate analgesics and provide clear aftercare instructions. Pain management is crucial for patient comfort and recovery. Let's not forget soft tissue injuries. These can be quite alarming due to the amount of bleeding. These can bleed a lot, which can be distressing. It's important to stay calm and reassure the patient. Apply direct pressure with a clean gauze or cloth to control bleeding. This is often the first step in managing soft tissue injuries. If the wound is deep, it might need suturing. Proper wound closure is essential to promote healing and prevent infection. Remember, keeping the area clean is crucial to prevent infection. Provide the patient with clear instructions on how to care for the wound at home. And before I wrap up, here's a quick tip for all dental emergencies. Stay calm and reassure your patient. Your confidence will help them feel more at ease. A calm and composed demeanor can make a big difference in how the patient perceives the situation. That's it for today's crash course on handling pulpitis and dental injuries in emergencies. Remember, practice makes perfect. Keep practicing and stay sharp. You've got this. The more you practice, the more confident you'll become in managing these situations. Don't forget to like, subscribe, and hit that notification bell for more dental tips. Catch you next time. Stay tuned for more valuable insights and tips to enhance your dental skills.